Across the Gaza Strip, hospital beds are full, and medicine is running out. That's according to Health Ministry spokesperson Dr. Ashraf Al-Qidra.
For sure, the quantity of wounded people arriving to our hospitals is huge. It will mean we won't be able to accept more patients in Gaza. We need safe passage to receive medical supplies in Gaza and to be able to take the wounded people from Gaza elsewhere to get them hospitalized.
Israel has put Gaza under what it calls total siege to stop food and fuel from reaching the enclave of 2.3 million people, and has vowed swift punishment after the deadliest Palestinian attack in Israel's 75-year history. More than 1,000 people have died in the retaliatory strikes, according to Gaza's health ministry. Hamas authorities say 250,000 people have been left homeless. There are fears an already dire situation in Gaza, which has been under an Israeli-led blockade for years, is becoming much worse. Outside hospital walls, people huddle wherever there's room. This woman says she ran barefoot when the airstrikes came. There was no time to grab diapers or baby formula. They are all victims. They're all women, children. What did they do? She asks. The U.S. has said it's talking to Israel and Egypt about safe passage for civilians. Egyptian sources say Cairo is open to aid, but not refugees, something it has long restricted. The UN's Palestinian Refugee Agency says over 175,000 people are sheltering in its dozens of schools across Gaza. Children play in the dark at this one, all as adults say they're worried about electricity and water shortages. Shortages weigh heavily on Gaza Red Cross spokesperson Hisham Muhammad's mind, too.
Nowhere in Gaza is safe. And this is the general feeling of the entire population, not only myself. I had to move my family for 3 times so far in the last 24 hours, based on information shared for larger communities in Gaza by the Israeli authorities or the IDF, asking them to move and evacuate this area and go to another area without clear instructions or safe passages. And this is a concern for the public, but also for the ICRC. The lack of clear instructions and safe passages could lead to more devastation or civilian loss, especially when we are witnessing an intensified, round of escalation or and airstrikes.